Hey guys, welcome back to my channel. So today I wanted to talk to you about being a labor and delivery nurse. So I got a little inspired. I was watching Stephanie's video on YouTube about her career. She's an accountant. So I got, I figured, hey, let's talk to you guys about being a labor and delivery nurse. There's so many different topics that I can cover about just being a nurse in general. But today I think we're going to start out with just being, the position that I hold. So just a little bit of background. I graduated from nursing school in December of 2011 with honors. Go me. But I took my NCLEX on Valentine's Day of 2012. I started working as a cardiac nurse 2 weeks after that. So working on a cardiac unit was a little intimidating. When I was in nursing school, I did not like cardiac. I did not like neuro. Anything with the heart and the brain, I know, right? Two of the most important organs in your body. I was terrified of them. But I think during my clinical rotations, I knew which area I wanted to go into. So, sorry. Alarm. So I knew that I wanted to go into labor and delivery. It was so fascinating. I was always interested in, just the whole pregnancy, the process of it all, just the delivery. Oh, and I just love newborns. So that was an added plus. So basically, as a labor and delivery nurse, you wear numerous hats. Okay. Let's start out with, incoming patients. On any given day, I can be in any of these roles. So incoming patients come in and they see the triage nurse, which, I happen to, do that position a lot. The patients come in, I assess them, I determine if this is an emergent situation where the doctors need to come in right away. If it's not emergent, I have them sit there. I assess them, I put them on the monitor, ask them a couple questions. Once I gather that information, I give it to the doctor. So it's kind of like a mini ER for pregnant women. Women come in for all sorts of reasons. It could be labor. It could be preterm labor. It could be they think their water has broken. It can be nausea, vomiting, headaches. Anything that they feel like I need to be seen for, we see them. The doctors come in. They assess them, they determine a plan, and either I admit them to the hospital or I discharge them. After that, let's say these women get admitted to the hospital. I could then be the labor and delivery nurse. So if I come on a shift one night and I have an assignment of a laboring patient, I would go in, I assess these women, I work with a team of either doctors, midwives, to manage midwives. Let's see, we do have interns. It's a teaching facility. So the people that I work with include physicians, midwives, anesthesiologists, and the rest of the nurses. So I'm helping to manage this patient. We watch the fetal monitoring. So we're monitoring baby's heart rate. So we put these little circles on the mom's bellies, two of them. One of them we put on to listen to the baby's heart rate, and the other one we put on to assess the contractions. So I monitor, I want to make sure that fetal well-being is okay, and I want to see how often the mom is contracting, how long they're lasting, and the strength of them. And I determine strength by touching. Okay. Throughout that whole process, I can give medications, doing constant assessments, doing constant charting. I'm charting all day long, depending on what type of medication's on, what type of medication the mom is on. It could be frequent charting, like every 15 minutes, or it could be every 30 minutes, every hour. It just depends on the situation. So I can have a mom that's doing a medicated birth, which is something that I did, which means she has gotten either an epidural or some form of analgesia through her IV. So if she has an epidural, that's a medication that she's getting. It's a catheter that's inserted in your back. So we place a huge needle in your back, well, the anesthesiologist does this part. I just assist. They put the needle in, they thread in a catheter, they remove the needle, tape down the catheter, and you're getting a continuous infusion of pain medication, which makes these mamas pretty numb from the belly down, which makes them pretty happy campers, because I definitely was. You can also get some medication through your IV. It's kind of like a one-time shot. So it's through your IV and it's through a muscle in your, somewhere in your body. A huge muscle would, be beneficial. So, this medication doesn't necessarily take the pain away, but it takes the edge off the contractions. This is like really, really great for someone who's been laboring for such a long time. It allows them to get some rest and get some sleep. This can also be a good thing for mamas who want to do it natural, but who's just been working hard for so long. It gives them that chance to have a break, take an edge off, the contractions, and maybe take a nap and get back up and get right back at it. But if you're doing it completely natural, this is no medication whatsoever. And we do have a lot of these. A lot of them are patients of our midwives, but we do have some physician patients who want to do this natural, and they do it for numerous reasons. So I'm supporting the patient the whole way through. I am, helping with different positioning. We have medicine balls. So the big exercise balls, we have them sitting on them. They help with descent of the baby. Also moving around on the balls, kind of a pain relief. We have aqua doulas, which are tubs that are in the room that women can sit down in and use the water as some type of pain relief. And we do have some deliveries in the tub, which are pretty interesting. Okay, you gotta see it. There are, you can get it in a shower, so lots of different things. Squatting, a lot of different things help. Okay, it helps if you have a good support team. So bring in your doula, bring in a sister or a mom, along with your partner. Basically that's, a day-to-day thing. Okay, so say for instance, a mom is getting a scheduled C-section, which can be for if you had a repeat C-section and you don't want to try for a vaginal delivery after that, or there are reasons that you can't try for a vaginal delivery after that, or there are times where we have to do it urgently, which means we have to rush the moms who are already laboring back to the OR. So the OR is the emergency room. So I would then facilitate as the circulator. So this is a nurse who's helping prepare and help the process along and monitor things during a C-section. So I'm trained to do that as well. After you leave out of the C-section, we have a recovery area for the moms who've had a surgery, and you're a PACU nurse. So I'm helping to recover this patient after surgery. There are numerous things that we need to keep an eye on, so I'm pretty vigilant on that. I'm also there with the baby. As with a normal vaginal delivery, I also help take care of the baby for the first 2 hours before we transfer either of these patients over to postpartum. The mother baby unit now. It used to be postpartum / nursery, but we got rid of that, and I'll explain that to you as well. So after these roles, I could also be what we call an antepartum nurse. So an antepartum nurse is a woman who comes in to the hospital for a complication, so obstetrical complication that we want to keep pregnant for a while, okay, but needs to be in the hospital for observation or to receive some type of medication, or basically just bed rest. Okay, so we're trying to keep these mamas pregnant for as long as possible. So the reasons that they could be there is maybe their water has broken and they're preterm, so we want to keep them pregnant for longer. They could be there for hyperemesis, which is also a condition where the moms are really nauseous and they vomit a lot and they can't keep food down, and it gets pretty dangerous, so we need to give them medications and monitor them for a while. You could be there after a motor vehicle accident. So we want to keep an eye on you for a while after that. Or, you know, there's a multitude of reasons where we may want to keep an eye on you. So we have a nurse specially dedicated to those patients. You know, so in any of these roles, you have to be, you know, really supportive and really knowledgeable, because these women need a lot of support and lots of education. So I think the majority of it all, I'm so happy that I transferred to this unit, not only because it's an interest, but it's a very specialized unit and a very good place to be. You know, I help participate in, you know, expanding these people's families. You know, they're bringing life into this world, and every single time it's different. And no matter what they come in there for, it's the same reason, but it's you know, the process of it all is different. And I am privileged to be able to be there as they add these little ones to their families. You know, the downside of it, and I'm not gonna lie to you, we do have, you know, bad situations. There can be, you know, a complication with the baby, you know, during labor, maybe not known or known. You know, sometimes women come in and they have what we call a fetal demise, where the baby has passed away in the mom's belly. So there are some pretty sad situations, but there's still a privilege of being there helping these moms, because they need a lot of, there are a lot of things that I want to cover just talking about nursing. So I think I'm gonna make more videos about, you know, what it's like to be a nurse, a day in the life of a nurse. I'll take you guys with me to actually, you know what, I have to work tonight. I just got finished getting dressed, so I'm gonna take you guys with me tonight and show you what it's like on my shift. There's not too much that I can show you guys, but I'll give you, you know, I'll give you a little glimpse. I'm also going to do videos about how to get into nursing school, how to be successful in nursing school. Yeah, so if you want to see those type of videos, you know what, comment below, tell me what you guys want to see, and those will be my next videos. I mean, this is Mommy Nurse Makeup, right? So let's get these nursing videos out there. You know, I'm really proud to say that I'm a nurse, and if I can encourage any one of you to join a profession, it would be nursing. We're ranked #1 every year for the most trusted profession. So I'm always happy to say what I do, and I love to talk about it. So let's get these videos started. Just so you know, when I post another video, make sure you subscribe so that you'll see when that video goes up. Don't forget, give me some thumbs up, and stay tuned for tonight. Come on along. Bye.